COPD, also known as chronic obstructive pulmonary disease, is a long-term lung disease characterized by chronic inflammation of the airways leading to restricted airflow. Types: chronic bronchitis. In this condition, the airways become inflamed and produce excess mucus, leading to persistent coughing and difficulty breathing. Emphysema. This involves damage to the air sacs in the lungs, reducing their elasticity and making it harder to exhale air. Causes. The primary causes of chronic obstructive pulmonary disease are related to long-term exposure to irritating gases or particulate matter, leading to inflammation and damage in the lungs. The main risk factors are smoking. Cigarette smoke is the leading cause of COPD. It irritates and damages the airways, contributing to chronic bronchitis and emphysema. Environmental exposures. Prolonged exposure to indoor and outdoor air pollutants, such as secondhand smoke, workplace dust, fumes, and chemicals, can increase the risk of developing COPD. Genetics. Some individuals may be genetically predisposed to developing COPD, especially if they have a deficiency in a protein called alpha-1 antitrypsin, which normally protects the lungs. Respiratory infections. Recurrent lung infections, particularly during childhood, may contribute to the development of COPD later in life. It's important to note that smoking is the single most significant risk factor, accounting for the majority of COPD cases. Quitting smoking is a crucial step in preventing the progression of COPD and improving overall lung health. Complications. COPD can lead to various complications affecting both respiratory and overall health. Some common complications include respiratory infections. Individuals with COPD are more prone to respiratory infections like pneumonia and acute bronchitis, which can worsen their symptoms and lead to hospitalization. Exacerbations. Sudden worsening of COPD symptoms, known as exacerbations, can be triggered by infections, air pollution, or other factors. These events often require medical intervention. Heart problems. COPD can strain the heart, leading to conditions such as cor pulmonale, where the right side of the heart becomes enlarged. This can result in heart failure. Decreased exercise tolerance. Shortness of breath limits physical activity, reducing exercise tolerance and overall fitness. Treatment. Lifestyle changes. Smoking cessation. Quitting smoking is the most significant step to slow COPD progression. Avoiding environmental irritants. Minimizing exposure to air pollution, occupational dust, and other irritants. Medications. Bronchodilators. Bronchodilators helps in opening airways and making breathing easier. Corticosteroids. These medications help reduce inflammation in the airways. Antibiotics. Antibiotics are used during exacerbations or respiratory infections. Pulmonary rehabilitations. A structured program is planned which involves exercise, education, and support to improve overall fitness and manage symptoms. Oxygen therapy. Supplemental oxygen is provided for low blood oxygen levels, improving breathing and reducing strain on the heart. Vaccinations. Annual flu shots and pneumonia vaccines are given to prevent respiratory infections. Surgery. In severe cases, surgical options like lung volume reduction surgery or lung transplantation may be considered. Treatment is tailored to each person's specific symptoms and severity of COPD,